So I have quite a few patients that I work with over in, weight management and behavior change, lifestyle modification, and I would like to share 6 things that I wish every one of my GLP-1 patients knew before they started their GLP-1 medication. So if you're new here, my name is Dr. Robinson. I am a licensed clinical social worker. I have my PhD in my field, and I am everyone's favorite bariatrics and diabetes behavioral health professional and an RDN loading. So if you're thinking about starting a GLP-1 medication, or you've just been prescribed one and haven't started it yet, here are 6 things that I wish all of my patients knew before they started taking their medications. These are not meant to scare you in any way. These are meant to help you because your GLP-1 is a tool in your weight loss journey and health goals, not the sole answer. So here we go. Number 1, it is a tool, as I said, not a magic wand. The GLP-1 medications are incredibly effective. Some of them have a lot of power in that appetite suppressant for patients, but they don't replace your healthy behaviors. So they can help reduce hunger, increase fullness, that gastric emptying piece that's a little more delayed so that you don't feel hungry right away, but you still need your body to have fuel. You have to still stay active, you have to build habits and maintain them for a long term. If you feel like you need support in that, reach out to us. That's why we exist. We are here to help cheer you on and keep you on the straight and narrow, as it were. So again, think of the medication as one member of your healthcare team, just like the rest of us are. Okay, number 2, you might not feel hungry, but you still gotta eat. One of the biggest surprises that I hear is how much people didn't realize that the appetite suppressant feature was going to hit them. They might have gone through most of the day not feeling hungry and didn't even realize that they hadn't had anything to eat since X time. So some people will realize that it's the end of their workday since they've had anything, and maybe the last time they ate was before they left the house to go to work. That sounds like a good thing until your body's missing out on things like, protein, fluids, vitamins, minerals, things that it needs to survive. Caloric intake is energy and fuel for your body, and it is important. Your goal is not to eat as little as possible. It is to eat enough of the right things that will help nourish your body. So be mindful in that idea. Not necessarily managing portions by not having them. Still need to eat. All right, number 3. Weight loss is not always a linear thing. Excuse me. There will be times where some weeks you lose weight. There will be some times where some weeks you don't lose weight. Some weeks you might even gain a pound or 2. It's going to fluctuate, and that's very normal. Your body's not just going to go in a downward spiral in terms of the weight loss number. So there are hormones, hydration, stress level, sodium, sleep, all kinds of other things, bowel movements, menstrual habits, menopause. We don't like that word around here. Makes people anxious, makes people nervous. Anyway, don't let one time that you step on the scale convince you that the medication, the lifestyle changes are all for naught. Excuse me. It is working. It's just a process, and it's going to take time. If you think about it, you didn't put all of that weight on in a matter of a few days to a week. It's not going to all come off in a few days to a week. Just take time. Number 4. Side effects usually get better, but make sure that if they aren't, or even if you're curious a little bit about a side effect you're having, ask for help. Mild nausea, constipation, feeling full quickly, sometimes reflux, those are all common side effects that can come with taking a GLP-1 medication, especially when it's your first time ever taking it or when you had a dose increase. Eating slowly, making smaller, more frequent meals throughout the day, staying hydrated, and following a schedule and a routine can really help. However, if you have severe abdominal pain, repeated vomiting, signs of severe dehydration, symptoms that don't improve no matter what you've done, even though you are trying to stay on track, message and or call your provider, because that is going to be something different. We don't want you to suffer in silence. Even if you're not sure if this is severe and it's severe for you, we'd rather you ask and let us assess what's going on as your healthcare team versus you assume, panic, and then just disappear and don't say anything until your follow-up in X number of weeks or months. Number 5, muscle matters more. It's so important, actually. This is one of the biggest things when it comes to what I see patients dealing with when I'm working with them in the clinic. We want you to lose weight, but we want you to lose fat specifically. We don't want you to lose your muscle mass. That strength and that muscle mass is very important, so we want you to hold on to it. So muscle supports your metabolism. It supports strength, independence, and your overall health. We don't want you to develop sarcopenia, which is where muscle weakness can form in. Most of the time, people see it in their grip strength kind of going away. And not just, oh, that jar was always hard to open, and so it's what it is. This is where things that you would normally be doing with your grip strength, you are no longer able to, or you are finding yourself struggling. So make sure that you are doing, strength training, whether that be going to the gym and lifting weights, Pilates and resistance training, yoga, using your own body weight and doing body weight exercises. All of those things help with strength training. Start off with 1 day a week for 15 minutes and then work your way up to a couple times a week. Also, while we're talking about that in terms of exercise and making that a part of your routine, get enough in fluids, okay? 64 to 80 ounces of fluids are usually key. And while we're at it, try and make sure that you're getting 80 to 100 grams of protein. That's usually a good place to start for most people. There are things that you can get out of your meals, of course, both whey and plant-based, but there are also protein shakes. There are clear proteins or protein waters that are now on the market. I've seen protein snacks. Some of my favorites are from Quest. I actually really like a lot of the clear proteins that are coming out on the market. And one of my personal favorites, protein sodas. I like having these with dinner when I do feel like I want something bubbly. It is very nice to know that I can still have that in addition to whatever meal I'm having. All right, number 6, do not compare your journey to someone else's weight loss journey. You don't know anything about them in the context of their medical history, their medical or health conditions, any of their family history, just like they don't know anything about yours. One person could lose 10 pounds in a month. One person could lose 5 pounds in a month. It doesn't mean that you are doing something wrong and that they are doing something better, or vice versa. It's not about that. Your age and your medical history and all kinds of things, medications that you might be taking, genetics that you are fighting hard against, activity level of motion, sleep, etc. All kinds of stuff, stress management, influence how well or not well your weight loss journey will go and at what trajectory it goes in. Those are things that sometimes are within your control and sometimes that are not within your control. Do not blame yourself. Do not compare anything that you see somebody else doing to what you're doing. If you have questions about things that you could be doing differently or how you feel about the speed or the trajectory of your weight loss, talk to your healthcare team. So, biggest piece of advice I can give: be patient with yourself during your weight loss journey. Healthy weight loss is an entire process, and it is a journey. We call it a journey because that's what it is. We don't want you to starve yourself. We don't want you to chase the smallest number on the scale. It is about improving your health and your health outcomes. We want you to hold on to that muscle mass and then create sustainable, long-term healthy habits so that you feel better in your body as well as that you see the health improvement, regardless of what that number on the scale does. If you have questions along the way, don't do this by yourself. Ask us. Ask any of the providers on your healthcare team, do your research, things like that. Your physician, pharmacist, friendly neighborhood dietitian, friendly neighborhood behavioral health specialist. We are all here to make sure that you get to the end of your journey in whatever your time frame is, as well as what your body is actually going to allow you to do. Your time frame could be yesterday. We're going to work on getting you there at some point in the healthiest and most sustainable way. Just give yourself a chance and give yourself time. Follow me for more evidence-based education on obesity medicine, diabetes, nutrition, and behavioral health. This is not meant to replace anything that your medical or healthcare providers have told you. This is very general information, kind of an understanding, but please, please, please follow what your providers have told you to do with your health management and your weight management. Bye.